sky or winter chill. If I gotta take a break, I will. But I'm gonna run right up this hill. I wanna hold the whole wide world right here in my open hand.
Hey guys, it's Khaki. It's the morning of my plastic surgery for my torsoplasty, which is a back lift, and my breast lift. I just got up. It's 4 a.m. I have to be there at 6. So I'm about to jump in the shower and take a shower with Hibiclens. They said any antibacterial soap, but in the medical profession, we know Hibiclens is the best. So that's what I'm using. I have got my little nest made. I think that's always important before you have surgery to get everything ready for when you come home. I've got my recliner. I've got my heating pad for my lower back. This is just a $100 recliner that I got on Amazon, and it has gotten me through 2 surgeries, or about to get me through 2 surgeries. I don't have a recliner and got this, and it is wonderful. Got a blanket, got all my chargers handy. I have my notebook to write down when I take medicine. Got my medicine and some hard candy and my grabber, my computer charging. I am ready. For when I am able, I have my pillow system, my pillow wedges. I'll have to sleep sitting up for a few weeks probably, so I've got that ready. I used this when I had my tummy tuck and arm lift and loved it. And it was not expensive. I got it off of Amazon for like $78. Okay, guys, I hope you can see this. This area right here is what we're going to be working on today. The front looks good where I had the tummy tuck, but when I wear clothing, and of course I've got my arm up now, so it's making it a little bit less obvious. But when it's down, this really shows in shirts, and it really bothers me. I mean, it can really, it kind of directs what shirts that I wear, and I feel like I have worked so hard on getting my weight off. I don't like this extra skin, and I do get rashes under it. It's very pendulous, so that's what we're going to be getting rid of today. Well, YouTube won't let me show you the boobs. What can I say? So just gonna kind of give you a visual as much as I can. Before I had weight loss surgery and lost 142 pounds, I was a double D cup. Now, I'm about a C cup, but it's primarily skin. When I do not have on a bra, my breasts hang to about right here, and my nipples are about right here, pointed straight down. So the surgeon told me after surgery that I will probably be a B cup, maybe a big A cup, but that I might not have to wear a bra, or I could choose not to wear a bra. I'm not having implants. I'm okay with having small breasts. Small breasts sound wonderful after years of having big breasts. So I'm just getting everything lifted. You know, in a bra, it looks fine. But here again, it bothers me, and that's what it's about. If you are able to do something that makes you feel better, I'm all for it. Again, this is not something that I really went into my consult even thinking about having done. And the surgeon, not to convince me to add on another procedure, I was going to do the back. He said, if you've ever thought about having the breast done, this is the time to do it, because we just lengthen that incision circumferentially. Of course, I am going to have an anchor incision. You can look that up and see what that is. But he said the recovery would not really be any additional. Actually, the cost was not a whole lot additional. So that's kind of where I'm at with this. I'm outside of the surgery center about to go in. Hey guys, I'm home from the surgery center. I ended up with 2 drains when the plastic surgeon was doing the drawing this morning, the marking of incisions. He told me, he said, I'm going to have to remove a lot of skin, so I will probably put in a drain. I was okay with that. A little hoarse from the intubation, but everything went great. I actually had the same nurse anesthetist and the same OR nurses and the same recovery nurse that I did last time, so I was familiar with them. I will be making videos, updating my progress. I'm gonna do, excuse me, full of gas. Gonna do one, do a little daily video, but I'll consolidate them into next week's video. So I hope everybody is doing well and happy Thanksgiving. I have, look what I've got. Let's see if I can do it. I am doing really well because I have my sister with me who's a registered nurse, and I have Caroline, who is the best nurse ever. Caroline, there we go. Hey guys, it's Khaki. It is the day after my surgery, back lift, also called torsoplasty and breast lift. I'm doing pretty good today. I did have a little bit of a scary incident last night. I am getting up and walking with the assistance of my sister, you know, to keep things moving, prevent blood clots. That's what's recommended. And I went into my kitchen, started feeling faint, sat down, and nearly passed out. What happened was my blood pressure dropped. It was too low for my sister to be able to check it with the electronic machine, and she couldn't palpate a pulse in my wrist, which means that my top number was below 80. So it was really tachycardic, had a fast heartbeat, oxygen was low. She helped me to lay down, put my feet up, immediately felt better, sprang right back. So I think that it was a combination of the after effects of anesthesia, and I had taken some pain medicine about 2 hours previously. With those of us who have had gastric bypass, absorption is not guaranteed. It could have been that the medicine was just laying there and then absorbed all of a sudden. Who knows? Of course, I was also probably dehydrated, hadn't eaten all day, so it was just kind of the perfect storm. Thankfully, my sister was here with me. Everything was okay. I feel fine today. I got up. She helped me take a shower. Feel great. So, well, not great, but okay. So I am not, excuse me, I've still got that drainage. Trying my best not to take any pain medicine because I am very concerned about having another blood pressure drop like that. So doing this without pain medicine, so we'll see how that goes. I will update you tomorrow. Bye. And I do still have my best nurse, Caroline, is taking good care of me. Hey guys, it's Khaki. I didn't realize how bright that sun coming through that window is. It is 2 days after my surgery, and I'm feeling a little bit stronger every day. My sister came up this morning, helped me get a bath, and she helped me fix breakfast. Then I fixed my lunch on my own. I've been around the house quite a bit. I have not needed any pain medicine, as I said in my previous video. Trying to avoid it, so I'm managing just with Tylenol, and so far I'm doing okay. Hey there, it's day 3 after my surgery. Everything is going well, except I am beginning to get stir crazy. I am just not used to being home like this. I'm walking around looking at things that I wish I could do, but I'm just not quite up to it. I still have restricted mobility, of course, in my upper arms, although my pain level is manageable. I'm just taking Tylenol. Haven't taken any pain medicine except for that first dose when I got home and I had the low blood pressure. Do have a little bit of a low-grade fever today. I don't necessarily think it's an infection. It's very common to have low-grade fever after surgery, kind of is the immune inflammatory response, but I am keeping an eye on it. My surgeon said if I have a temperature of 101 or above to let them know, and I'm running like 99.6, so nothing bad. The drainage in my little trusty drains is not very much, so I have got my fingers crossed that when I do my post-op appointment on Monday morning that I will get them out, because I'm planning on going back to work Monday. Hey guys,
let's see, it's Monday, so that is Thursday, Friday, Saturday, Sunday, Monday, day 5 after surgery. Oh, as you can tell, I am tired. I went back to work today, and it's been challenging, not too bad, but I'm just exhausted. To top it off, this is my late night, so I saw patients until about 7. Went to the surgeon this morning for my follow-up, got my drains removed, yay! Was glad of that, but then by the time I had gotten to my office, I had leaked through the bandage, bled through the bandage. I guess had a lot of accumulated blood under the skin on one side. Today, I am very bruised. I think the bruising has gotten worse throughout the day, maybe because I'm up more, but my breasts especially are just solid purple. Not terribly painful. I just feel tight. That's the only way I can describe it. I feel like, you know when somebody gives you a bear hug and it gets a little too tight? That's how I feel, even when I don't have on my compression bra. I do have a little bit of swelling, like right above the belly button. But still, pain has been tolerable. I've just taken Tylenol. I did just take some Tylenol and some gabapentin and a muscle relaxer, which is what my doctor gave me to take short of opioids if I, felt like I could manage without it. So that's what I'm taking tonight. It is 9 o'clock at night and I'm about to go to bed. Bye. Just a short addendum to the previous video. I am trying tonight for the first time to sleep in the bed with my wedges. I have been sleeping in the recliner since surgery, so the plastic surgeon said this morning I could try to do with the wedges, whichever I felt more comfortable with. He did say everything looked great, by the way. Hey guys, it's day 6 after my plastic surgery, my 360 upper body lift. Everybody calls it something different. Some people call it a back lift with a breast lift, other people torsoplasty, other people 360 body lift. I worked today, just got home from work and feel like I did really well. I can tell that I'm getting a little bit stronger every day. I tried to sleep in the bed last night. It didn't work out. I ended up back in the recliner. I couldn't get comfortable in the bed. So I talked to my plastic surgeon's nurse today, and she said that since I did not have implants, that there was nothing prohibiting me from trying to sleep in the bed on my side or with pillows and not just the wedge, that it was basically up to my comfort level. So I'm probably going to stay in the recliner for a few more days. Then I'm going to try to get back into the pattern of sleeping flat or sleeping with pillows on my back or on my side like I normally do. I hope everybody's doing well. Hey guys, it's Khaki. 1 week ago today, I had a 360 upper body lift, also known as a breast lift without implants and a torsoplasty or back lift. Headed to work today. I have been back to work 2 days before this. Feel like I'm doing really good. Pain level has been minimal. I have managed my pain with just Tylenol, and at night I'm taking a muscle relaxer that the plastic surgeon prescribed. I can't take it in work because it makes me too sleepy. But I haven't been in much pain. It's just still that feeling of tightness, which I remember from when I had my tummy tuck and arm lift in the spring. I remember that feeling of just tightness. But overall, I think that it has been a really good post-op period. I am not, I can't think of anything I would do differently, and I think I will be very happy with the results. So I'm going to put together the videos from this past week post-op, post them today. I would love to hear from everybody where you're at in your journey. If you are considering plastics after your weight loss, or if you've had them, what your experience was, any questions that you have about that. And I hope everybody has a great week. We'll see you next week. Bye.